Hello, students. Today, we represent Georgia State University's School of Public Health. Lauren as an undergraduate student, Cherell as a graduate student, and myself, Dr. Jacque-Corey Cormier, as a professor. Lauren, do you mind telling them a little bit about yourself?
Absolutely. So hello, everyone. My name is Lauren Gibson, and I am a senior at Georgia State University in the School of Public Health. I hail from right here in Atlanta, Georgia, and I am a proud alumna of Benjamin E. Mays High School. I am the mom of an 11-year-old, and I currently am employed as an implementation consultant for ADP. I am what you would call a non-traditional student. And what that means is that I've had a break in my college education after high school. I became a mom and I entered the workforce prior to continuing my education. So I decided to re-enter college last fall to finish ultimately what I started. And I initially started my collegiate career at the University of Notre Dame, where I started off majoring in biology. And of course, I knew I wanted to be an OBGYN because, like many of you, I had my entire life planned out from beginning to end. But I got to Notre Dame and I found out very quickly that that was way too far away from home for me, and I had a complete culture shock. So shortly after I started at the University of Notre Dame, I came back home and decided to go back to school at Oglethorpe University. Then what happens? Life again. In my senior year, I had my son, thought I was going to get married, and I stopped being able to finish up with my college career at that time. So when I had my son, there were a couple of things that I knew. I knew that I had skills that were employable. I was a leader. I had experience working in a few HR roles, albeit smaller. And I knew at that time what I needed to do was find something that allowed me to be a parent as well as support my son. So I remembered having a time where I picked up the phone and called around to all kinds of temporary agencies. I sent out emails. I said, who is it that will listen to me, that will try to help me get to where I need to be? And ultimately, that is exactly how I've been able to get my foot in the door for every single job that I've had. And thus far, I'm proud to say that although I hadn't finished at that time my college education, I've done pretty well for myself and have been able to do well supporting my son just by, building and leveraging conversations and leveraging relationships that I had made over the years, as well as leveraging the current skills that I had built from just being in the workforce. So in addition to that, one of my passions has been establishing and working with one of my really good friends to run an organization called Black Girls Cheer. And Black Girls Cheer endeavors to show the world that Black girls cheer and do so much more. And one of the reasons why I'm so invested in Black girls and cheerleading is because when I was growing up, there just wasn't a space where I felt seen and heard. So I wanted to do what I could in order to provide that space for other young women that looked like me. And one of the primary reasons why I decided to re-enter school is to really just gain some additional knowledge that would allow me to take this platform and take the things that I'm doing to that next level so that I could better understand the population of young women that I really wanted to positively impact. So through the organization, we've done some really amazing things. We have thus far filmed and released one documentary, and we're working on another documentary that we know is going to do some really amazing things within the community. And again, we'll just provide yet another opportunity for these young women to have another platform that will give them a voice and give them a level of visibility.
Thank you. Cherell, how about you tell us a little bit about yourself?
Hi, everyone. My name is Cherell Cotrell-Daniels, and I am a PhD candidate, which means I have met all of the coursework and my comprehensive exams, which is a huge exam, which means you have mastered specific competencies. So I have completed all of that, and I am now in the phase of writing my dissertation. So I am originally from San Diego, California, born and raised, went there for high school, and I always knew I was going to be a doctor, a pediatrician, to be exact. I knew that like since elementary school. I just knew it. So all of like middle school and high school were just formality because I needed to go to college so then I could go to med school. So I had my future planned out. Well, when I got to college, I began taking courses and I realized I didn't want to go to med school anymore. I was like, I don't want to be in school for 8 to 10 years. I don't think being a doctor is for me, but I still had a passion to help people. That has always been my passion. And I didn't know any other way besides medicine. However, as I continued taking courses and I switched my major from biochemistry to environmental science, I took a course called Public Health and Microbiology. And I was just fascinated in this concept of public health where we can help communities, so I can help more than one person at a time. So I decided I'm going to take a year off. I'm going to learn more about this public health field, and I'm going to apply to a master's program. Well, 1 year turned into 3.5. I kind of got comfortable not being in school. I also was working as a site coordinator for after school program, and I loved my kids. I loved working with my kids. But ultimately, I knew I wanted to get my master's. So I'm applying for master's programs. I keep getting no, no, no. And one day I just told my dad, you know what, maybe I'm not meant to get my master's and I'll just get a job. I'll work in somebody's lab. I can do lab work. It's easy. Well, the last round of applications, I got accepted into Georgia Southern University here in Georgia. It's in Statesboro, down near Savannah. And that was the best decision I ever made. It was hard to leave California, very uncomfortable because none of my family is here. But while I was at Georgia Southern, I was able to, I was accepted in an international research program for minority students, and it was federally funded. So grants paid for me to study abroad in Thailand. And I lived in Thailand for 3 months, and I conducted research focusing on depression in Thai adolescents, which is not a concept for them. So they understand sadness, but depression is not a concept they understand. And I was fascinated with that because here in America, we know, like when people talk about being depressed and knowing they're sad more than a few days and that something's wrong. So that piqued my interest as far as mental health, and me really thinking about what does mental health look like in adolescence. So I took some time off after my master's and I worked at Mercer University as a project coordinator, and that project focused on low-income adults in Southeast Georgia, so Vidalia, Swainsboro, Mount Vernon, those smaller towns, and helping people manage their diabetes and or high blood pressure. So the goal of the program was to give them information on how to change their diet, their exercise habits, so making sure they're moving, having some mobility, and they're not just sitting all the time. And also giving them information on how they can manage their high blood pressure and diabetes, and eventually they can get rid of it. A lot of times the participants thought they would just have to take the medication for the rest of their lives, and there was nothing they could do about it. So with that program, that sparked my interest in delivering information over a telephone. Normally, you know, people would come in person and you would do the program with them. Well, we did this all over the phone, which helped with engagement because participants didn't have to leave their house or they didn't have to drive a long distance to get this information. And then after I worked at Mercer, I was accepted into Georgia State's doctorate program, which I'm currently in now. The first time I applied, I did not get in. But the second time I got noticed that I got an interview, and I just knew I got an interview, I'm getting into this program. So again, if you hear no, don't let people tell you no, that's not the end. But right now I'm currently working on my dissertation, which focuses on African Americans and combustible tobacco use. And I'm specifically looking at little cigars and cigarillos and hookah use and the perceptions around that among African Americans, and what are some risk factors and protective factors, specifically among youth and young adults. My goal is to help reduce the tobacco-related disparities we see among African American adults. So my idea is that if we can prevent youth and young adults from using these products, that it will reduce the adults that continue to use these products even after they've been diagnosed with cancer or hypertension, because tobacco is a risk factor. So a day in my life pre-COVID, I would be here on campus Monday through Friday, recruiting participants, screening participants for our study, doing follow-up calls, administering surveys. And when I wasn't working with participants, I would have my own classes, or I would be writing up abstracts to submit to conferences, and also working on papers that will be published. And a memorable high that I have here at Georgia State is last semester I taught my very first class. It was called Research Methods. And although my class had to switch to online, my students all participated, they remained engaged, and they spoke very highly of the course. And it just reignited my passion for teaching. Although I do enjoy research, I love teaching. I love seeing students feel confident in the new information that they're learning, and also just see budding scholars. Although they're in undergrad, they are scholars. And that is my time. Thank you.
Thank you. So, like I said, I am Jacque-Corey Cormier. I am a clinical assistant professor here in the Georgia State School of Public Health, and I hail from Decatur, Georgia. As a psychology major at Morehouse College, I was part of the John H. Hopps Junior Defense Research Scholars Program, geared towards preparing students for admission into top-tier graduate STEM programs. Through that program, I was introduced to scientific research and was able to participate in summer research opportunities at Princeton University and the University of Illinois at Chicago. My undergraduate experience built my confidence and interest in social psychology research. Social psych is about how we interact with each other based on our backgrounds, upbringings, and perceptions of each other. So I applied to multiple PhD programs and got into none. I then applied to Georgia Southern's experimental psychology master's program and got accepted. At Georgia Southern University, I gained my teaching experience as a teaching assistant and continued to build my research skills. I conducted original research for my master's thesis, which is a long project and paper, and applied again to multiple PhD programs. I decided to go with Georgia State University because of its community psychology PhD program, where I fostered my program evaluation skills and worked within Atlanta communities to build youth-serving programs, political action, and a better understanding of people's needs. In my community psych program, I got my first international experience through the Tanzania Study Abroad program, geared towards understanding the social and historical context for current skin bleaching practices and health implications. Also, while at Georgia State, for my PhD, I was a group fitness instructor for the gym and did consulting projects related to research management and program development. To earn my PhD, I completed my dissertation, an even longer project and paper, examining how young people's leadership experiences related to social intelligence, self-efficacy, and transformational leadership skills. A typical day as a professor includes grading papers, these days virtually teaching classes, preparing for the next semester of classes, being at different committee meetings, and writing for grants, projects, and publications. A memorable moment is recently I've been on NPR's Closer Look with Rose Scott twice. One time representing GSU's faculty calling for more inclusive practices and policies at the institution, and another time talking about the Youth Leadership Development Program, 21st Century Leaders. So that's a little bit about us. But Lauren, what advice do you have for young people when it comes to careers and college?
So I would just say be okay with failing. one of the best things that I ever did was not succeeding in every single thing that I thought that I was going to do over my lifetime. In that process, I learned a lot about myself. I learned a lot about who I wanted to be in the world. And now I get the opportunity to really show up in the world the way that I planned on initially, with a much clearer mind. And even as a student, I recognize now that I'm a much better student than I ever could have been 10 years ago. So I appreciate those experiences. And I hope that you will as well, as you learn to fail and just get back up. And just remember that, you know, you are exactly where you need to be at exactly the right time in order for you to do exactly what you're supposed to do. And rest assured, and no matter how low you may feel at any given point, on the other side of that feeling will be your breakthrough and you'll be successful.
Wow, thank you for that. Cherell, any advice for the ninth graders when it comes to college and career?
I'm going to go off of Lauren a little bit. Going outside of your comfort zone. So although it's not going to be easy, I promise you, like high school, college, your first job, it's not going to be easy, but it's okay. You just have to push yourself, because as you push yourself, you grow, you learn things. And you're not going to get it right the first time. No one ever gets it right the first time. I would also say find your passion. Your passion can help you in those times where you feel like you don't know what to do, or if you're doing an assignment you don't really care about, but knowing what you're passionate about and maybe knowing that this is just for right now can help push you through. And also, your path will not be linear. It's okay to plan, but try not to be so strict with your plans. Be flexible. You'll get to where you need to go in time. Everything doesn't have to happen when you want it to. So just remember that you'll eventually get there, and then enjoy the journey while you're doing it. Just enjoy these moments of being exactly where you are. Being in the ninth grade, it's fun. Enjoy being in high school. Do not rush it, because the older you get, you just get more responsibility. So just enjoy these moments where you don't have to be as responsible, because it will come. And then you'll have to manage responsibility while also still trying to enjoy being in the moment.
Wow, greatly said by both of you all. And I'm just going to give one shred of advice. No amount of planning will guarantee your fate. Ask the people who graduated spring 2020, those who have been laid off, those who have had opportunities deferred, and do not assume that your undergraduate major is going to be what you do for the rest of your life. I majored and got degrees in psychology. Now I work for the School of Public Health. We are Georgia State University School of Public Health, and we thank you all for listening to us.
Thank you.